Hi, good evening, all. This is Professor Ajtih Pillai, Senior Cardiologist, Kaveri Hospital, Kovilambakam. Welcome to all. Today is a day where we are discussing a very important topic, which is heart health and how our daily habits is going to influence the cardiac health. So this is a very important topic, and it is as usual. We will be discussing some of the important aspects in our daily life, which is going to affect our health, adversely affect our heart health, and how we can actually come out of this particular problem. Okay, so this is a kind of more of a common topic, I would say. It's not a hardcore medical topic. We are actually discussing some of the lifestyle issues which can adversely affect our health. So what is heart health? As you know, heart can be affected in various ways, and most important way it can be affected is the what do you say, the ischemic heart disease or coronary artery disease. This is sometimes the most common. In fact, this is the most common heart disease which we see in our population, not only in India but across the globe. Now, when we talk about ischemic heart disease or coronary artery disease, heart disease means the heart disease which is involving the vessels, blood vessels, which supply the blood to the heart. Okay, so heart supplies blood to the entire body, but for the heart also blood is required for it to pump incessantly. Correct. So and because this the heart is a muscular pump, it requires high quantities of oxygenated blood. So it is one of the organs which is affected by um, uh, lack of oxygen or lack of enough blood flow very early. We see ischemic heart disease or this coronary artery disease, especially in very young people. So that is the most important health issues for us. We see patients in the 20s, 30s, 40s, etc. There are many reasons actually. We have data coming from India and as well as Southeast Asia why a specific population or specific ethnicity is involved in much early in their lifetime. And there are many answers to this. One is actually very high prevalence of diabetes, very high stress level. We as a population are changing globally because of the global pressures. Our work culture, more of urbanization, high workload, high stress load. So all this could be partly playing a role in causing this premature coronary artery disease or ischemic heart disease, which is involving the young in the early age. Now, what are the habits, daily habits, which are going to negatively affect the so-called heart health? Okay, so one is actually lack of physical exercise. We keep preaching every sessions, every medical as well as every non-medical interactions with patients, communities, associations, medical camps, etc. So lack of physical. What is adequate physical exercise? The adequate physical exercise, as per the WHO and as well as the American College of Cardiology, is actually about 20 minutes of regular walking. This is a very what do you say, very modest requirement we is required to do. We don't have to do 1 hour gym, 1 hour cardio treadmill, or 1 hour swimming, etc. So it's a very modest requirement only we are pushing across. This is basically about 20 minutes of very casual regular walking. And what does this affect? This will totally change the metabolics. So even a minimal exercise actually going to change the entire body hemodynamics for you. So the blood circulation to the legs start increasing, the blood vessels in the legs start dilating, you start to sweat. There is peripheral vasodilatation or the cutaneous vasodilatation. A lot of molecular level changes also happen, which could potentially benefit the heart. So number one is actually, as I told, is physical exercise about 20 minutes a day. Now, second thing is the diet. Diet is very important. So this is a common question we have been asked. What is actually the ideal diet? So India is a country which is having a very heterogeneous food culture. The food culture or the food habits of people living in the North India is nowhere close to what the people in South India used to customize. So the same can be told about the West and the East. So it's very difficult to say a menu, give a menu card for the patients and say that okay, these are the items you can eat and these are the items you should avoid. So by and large, we would say that try to stay low in carbohydrates, and this is very important. So because there has been a paradigm shift in the dietary advice, we advise to have less of carbohydrates, less of fats, especially saturated fat. What is a saturated fat? Saturated fat is a fat which is coming from animals. So if someone is accustomed to non-vegetarian diet, or someone is used to having meat in their dietary routine, then we probably would advise to reduce the meat content. So meat is a good source of protein. We are not ignoring that, but meat has what you call as fat. Okay, so animal muscle has fat also. So that's probably not so ideal for our heart. So animal fat in a non-vegetarian diet may include a fat in the animal flesh. In a vegetarian individual, again, this can happen because they consume a lot of milk, and milk is from animals. So milk fat, cheese, butter, etc., could also be a potential source of saturated fat. At the same time, unsaturated fat, that is vegetable fat, fat which are getting from nuts, oils, fish. For example, fish has a high content of unsaturated fats. All these are good for the health. So we discuss about two important points. One is exercise, another is diet. And third is actually habits. What are the habits? Smoking. Smoking is highly dangerous for heart. Smoke has nothing to benefit heart. That's the problem. Even alcohol, one could say that very small amounts of alcohol in practice probably will have some beneficiary effects on the cholesterol levels. Although no cardiologist is going to advise you that okay, you can have alcohol on a daily routine, because on the whole, if you're an alcoholic, it can cause a lot of other changes, because it can actually bring up your blood pressure, that can be harmful to heart. It can cause decrease in the awareness, decrease in concentration, increased risk of accidents, especially if you're driving after alcohol. So by and large, alcohol is not recommended. But for the heart per se, when we compare with smoking or any of these nicotine containing addictive habits, could be very harmful for the heart. It can cause narrowing of the blood vessels. It can cause blood thrombus, blood to clot. It can cause acute heart attacks. It can cause changes in the way the heart is beating. All these things can happen. So strict no to tobacco and nicotine, or cigarettes, or any of these related habits could be strongly discouraged as far as heart is concerned. The fourth one is actually control of risk factors. What are these risk factors? If you are a diabetic, control your blood sugar. If you are a hypertensive, or if you are a BP patient, try to control the blood pressure adequately with medicines. And um, if you are having high cholesterol, this could be by genetic, by family. You may have a high cholesterol and you are inherited the tendency. You may have to take medicines as well as lifestyle measures. If you are having any other risk factors, like for example, if you happen to have some kidney disease. Again, kidney disease actually is a very important risk factor. So you have to control your consult your kidney doctor and take your medicines appropriately. So by and large, these are other risk factors which can potentially affect your heart. Now, this is what I would say. So the daily habits which can potentially harm our heart health. Now, what are the positive habits? So this is exactly the reverse of what we were totally discussing about. So one, as I told you, good exercise schedule, 20 minutes of walking. If you are a good athletic person, we will recommend you to just walk, not jog for 20 minutes, and do some relaxation exercises. It's very important. Mental relaxation exercises you should try to do. I forgot to mention about the stress factor. No, it's very difficult to subject you to make it a subjective topic, because stress is there for every individual in a different way. And we used to say that stress is there everywhere. No, it is the situations and the individuals make stress in your life. But please understand that stress is something is always there. Situations, uncomfortable, emotional, disturbing situations are there in every walk of life. But how you react to that particular situation, that is the stress. So stress is basically highly individualistic. How you react to that particular uncomfortable situation is basically called as stress. Like a bad news approach, you are thrown out of your job. So that is a situation, right? So if you become very nervous, if you become frustrated, if you start throwing into tantrums, then that is a bad stress reaction. But at the same time, you acknowledge the fact that, okay, I can many other jobs to fetch upon. This is good that I lost this job, so that also opens up my the other avenues for another job. This is actually the positive attitude. So an individual can react to an abnormal situation in many different ways, and that is called as good or intelligent stress management. I just gave you an example, but this could be many, many different examples, many good different situations actually. So, if your work is giving a stress, you should find a way out how to come out of it. Individual ways of relaxation. Try to find happiness in your day-to-day activity, despite the work schedule. There are many things which you cannot change, but there are many things which are under your control. So things which you can control it in a better fashion so that the stress can be managed. So this is one of the things I forgot to mention in the lifestyle. Now coming back to the corrective habits, positive habits, that I told you: good exercise schedule, good selection of diet, low in carbohydrates, low in fat, good in protein, and good in minerals and vegetables. Another important thing is actually bring in the habit of drinking a lot of water. Water is one of the best medicines God has given us. Water can good amount of water in the body can avoid dehydration. It gives you good strength to think for the brain. It keeps the blood liquidy, less chances of clotting. It reduces the risk of high blood pressure. It controls your blood sugar. It improves the peripheral circulation, especially to the legs and small vessels. And it's only a benefit and benefit and benefit. So water, good amounts of water, a minimum of 2 liters to maximum of 4 liters, or 3 to 4 liters of good water intake is a good remedy for many of the issues. It reduces the issue of gastric problems. It reduces the issue of kidney stones. So these are some added benefits in addition to the heart health. So good exercise, a proper selection of diet, avoidance of saturated fat, a good amount of water in the diet. Another thing is actually reduction in the dietary salt. Whether you are high BP or a low BP or a normal BP person, if you are habituated to take low salt in the diet, your blood vessels will stay healthy, your heart will stay healthy. So a conscious reduction in the added salt or the avoidance of salty food is very important. Salt is a very cheap, it's the cheapest preservative. So any canned food, any kind of preserved food will be having a lot of salt. Manufacturers will add a little bit of more salt to make it stay longer, so it improves the shelf life. Like you cook pickle at home, you keep it, you wanted to preserve it for a longer time, you add a little extra salt. But the negative effect of salt is actually it can increase the blood pressure. It can make blood vessels unhealthy. So try to avoid excess salt in the diet. Salt is important because it has sodium, it has chloride. It's important for your body, but be judicious in the intake. So this is something which is related to the diet. And as I also told you, try to avoid nicotine and tobacco related products. The other thing is actually stress management. So in addition to making up your internal milieu to combat stress, you should also have stress busting exercises. Yoga, for example, relaxation exercises. If someone is so happy and feel relaxed in listening to music, and that's the best remedy for stress buster for that particular individual. So each person will have different stress relieving or relaxation modality. So that probably one has to find it out. So this is in overall. I would say that how you have a positive habits in your to maintain a healthy heart. Now, sleep. Sleep is another important thing. One should have a good quantity of sleep to have a good heart health. Why? Because lack of sleep will make you down in the daytime, will keep your blood pressure high, uh, will again adversely impact a lot of hemodynamics, a lot of blood biochemical values. It can keep your blood sugar uncontrolled. It can keep your blood pressure high, as I mentioned. It can rearrange your blood lipids or cholesterols. It can cause heart attacks. Lack of sleep is a suggest that you are very stressed. So again, it comes in all put together as in one particular group. Now, what are the signs of a healthy heart? Well, a good, relaxed personality, very meticulous way of dealing with stress that one has matured into dealing with good diet choices, taking someone taking a lot of fruits and vegetables in their daily menu, less of fat, less of oily food, less of carbohydrates and cereals, predominantly on proteins, but at the same time taking a lot of fruits and vegetables. I would say good amount of water, very important. Then lack of smoking, avoiding excessive alcohol consumption. These are some of the highlights of having a I would say a near perfect lifestyle. So I would say probably I touched upon most of the important points, and then probably I made this lecture in a very casual way. I'm not prepared any kind of major script or kind of schedule for this, so that I think we can discuss some of the common aspects. So the last thing I would say is actually drugs or medicines. So if you are diagnosed to have a heart disease, if you are diagnosed to have a high blood pressure or diabetes or any medical illness, try not to ignore it, try not to decline it. Take your medicines as prescribed by your physician in a proper way. That is also an important way to maintain a good heart health, because that will keep your parameters checked and will prevent worsening or progression of the disease. So this would, I would say, is another added parameter for maintaining a healthy heart. So with this, I think I would like to summarize. I spoke about for about 15 minutes on different part or different components of having a healthy heart, and I would like to listen to any questions from the viewers in this regard. Mr. Chinmay is asking, are there any supplements or vitamins that can improve heart health? I mean, Chinmay, it's good that you have asked this question. I get a lot of patients who are prescribed on some of these, I would say, supplemental prescriptions or tablets. None of them are actually scientifically proven. I would not recommend any of these medicines for maintaining a heart health. See, all the minerals, all the vitamins, all the ingredients what you want in a normal diet, God has given in the nature. So if you have a habit of taking good diet, that's more than enough. So the simple answer to your question is actually no. There aren't any scientifically proven supplements or vitamins that can consistently improve heart health. Mr. Kishore is asking, what are the warning signs of a heart attack? Well, heart attack can happen to anyone at any point of time. The major signs are chest pain, which is central of the chest, which can be squeezing, which can be a burning sensation, which can be kind of terribly disturbing. At the same time, sometimes it can be very minimal, but usually it is persistent and discomforting. And this pain can be associated with sweating. We can have vomiting. The pain can radiate to your left arm, can radiate to your chin, can radiate to the upper part of your tummy. The basic summary is actually it is quite uncomfortable chest pain, which is not getting relieved immediately, and you are disturbed with that. It's an annoying type of chest pain. Yeah. And in addition, sometimes you can collapse. Sometimes it can be the attack can be so massive that you can suddenly lose consciousness. Some individuals develop high heart rate, some individuals develop low heart rate secondary to heart attack. So sometimes that could also be some of the presenting symptoms. Yeah. Thank you. Strechana is asking, is daily having tea 3 times creates a risk related with heart? No. In fact, there are a lot of controversial research happening on tea and caffeine, and none of them have concluded or conclusively proven that tea is bad for health. Same as can be told for caffeine. The only suggestion I would say that if you're taking a lot of tea, I would have it with less sugar. Having lot of sugared drinks, whether it is soft drinks, whether it's your fruit juices or preserved fruit drinks, or even tea, coffee is not good. So reduce the sugar content of that, and take the milk component of your tea in a very judicious way, so that the milk is having less in fat. So those are the adjuvants which are there with the tea, which can damage the heart, but not the tea per se. Yeah. Gaurav is asking, does brain issues affect heart health? Not exactly. There are some diseases, like if you have a bleed in the brain, sometimes can cause a change in your heart rate and change the way the heart pumps, etc., etc. Someone who is having blood infections, for example, sometimes can have heart health. For example, even COVID, a very minority of patients with COVID can have affection of the heart secondary to the affection of the lung. So any vital organ in the body, whether it is brain, whether it's kidney, whether it is lungs, can affect if they are, if they have reached a stage of end stage failure, say, can affect heart health. If a severe brain injury can affect heart, but otherwise no. Otherwise no. In a general sense, no. Yeah. Shubham is asking, does eating once a day have any effect on heart? Well, not exactly, but it all depends. Like, you are not binging on it. You are, rather than 3 times or 4 times, you are taking on one time. So you have to be very careful that what you are eating on that time, right? And as I told you, that the other components of the diet, it's not about the calories you take, but the water level, the overall hydration level in your body can also matter. Most of us, irrespective of the part of the globe we are living, our body is habituated to take twice a day or thrice a day diet. If someone, for argument's sake, say that, I live in Antarctica and I used to take once a day diet from my childhood, as practiced or as taught or as customized by my parents, yes, it could be good. But out of the stress, let's say we were taking 3 times a diet for nearly 30 years, and suddenly you change, then it could be a problem. So there's a sudden change in the dietary habit, which how the system is going to take, we don't know. For example, if you don't have sugars in the diet for some time, your liver starts synthesizing the sugar, so it breaks down a lot of lipids, it breaks down a lot of fat, and it breaks down stored starch or something called glycogen. So many of things can have abnormal impact, which is unpredictable. If this change in the eating habit is because of any particular stress level, or let's say you are into a dieting, you want to significantly reduce your weight, then we have uh, seen that this dieting causes excessive stress on the body, and that stress can affect the heart. Otherwise, no. But if there is an abrupt change in the dietary frequency, as I mentioned, from either 3 times to 1 time or 2 times 1 time, sometimes it can cause issues, which is not predominantly related to the diet per se, but related to the stuff I already mentioned to you. But the answer to your question is, it may and it may not. Priyanka is asking, how can one create a hearty, healthy environment at home and work? I think, Priyanka, this is a good question. I think this is actually a family job. I would say this is a culture change, and these habits have to be practiced by everyone in the family. These habits have to be practiced by everybody in the workplace, your friend circle, etc., etc. Suppose I tell you an example. Suppose you are in a perfect healthy diet, right? And you go to have a dinner with your friends, and they don't practice this particular diet. It becomes a big problem. So you cannot socialize, they cannot socialize. So everybody in your circle, whether the friend circle or the family circle, should be aware of what is healthy is important. I'll give you an example. When we treat patients with heart attack, we at the time of discharge, we'll have a family counseling. So the diet the patient is going to practice after sustaining a heart attack is completely different from what he was doing earlier, right? So we try to convince the entire family about how their diet should change. You cannot have fried chickens and fried muttons on one end of the table, and all family members start consuming it, and then the patient who had a heart attack is just simply denied all those things. So And you know that heart attacks can run in the family. So it is not healthy practice to have one person alone practicing healthy diet. So I would say that this has to be a family job. Everybody in the family should practice this. So when it becomes like, for example, if everyone in the family decides that everyone is going to take less sugar in their diet, and that's a very, very, very welcome sign, because you are not only controlling your health, but you are also making positive impact of the health of other family members. So you're spot on with your question. Good that you mentioned this. You should practice awareness both at the family level as well as at your workplace level. Yes. Thank you again. Shreya is asking, does COVID vaccine has any effect on heart and it kind of heart attack? Well, we don't have any clear-cut data, Shreya. There's some isolated events, but it's very difficult to put it across, right? For example, heart attack can happen to anyone, right? And it can happen to vaccinated people, and it can take to non-vaccinated people. Suddenly, someone develops anecdotally, someone developing a heart attack. Incidentally, it could be related to a vaccine. Doesn't mean. So, for example, people used to say that rainy season causes more heart attacks. Is it true? No. Everybody develops heart attack at any point of time, right? Anybody can. So it's very difficult to say like that. So the simple answer is no. We don't have any conclusive data. The virus, the COVID virus, in some patients, we know that it can cause the COVID clot syndrome. It can cause the blood to clot in the lungs, in the heart, in the veins, etc., etc. But the vaccine in a large scenario, in a large extent, is pretty safe. We don't have the data. Manisha is asking, what are the female specific disorders that increase a woman's risk of heart disease? So all the risk factors I've mentioned, a couple of things. What I would say is actually menopause. Females are kind of generally protected in their menstruating ages. Let's say some 12 or 13 years to all the way to 45 to 48 years. So after that, the estrogen levels comes down, and then the estrogen related protection of the heart is less. And but this protection, what I'm saying, since let's say from 12 to 45, is damaged. It's not there if somebody is diabetic or somebody is hypertensive. Let's say when you become pregnant, you develop diabetes or high blood pressure, then this estrogen protection is actually nullified. So by and large, the menstruating age group is having a slight protection because of the estrogen levels, because estrogen is anti-cholesterol, anti-atherogenic, and it causes a lot of good changes in the blood vessel wall, which prevents from heart attack. So somebody who is in the nearing the menopause should take control of something. For example, menopausal weight gain is something which is not good, so they should practice a good dietary changes. Again, the same lines: low in fat, low in carbohydrates, good water intake. Their hormonal changes are pretty big at that time. You will develop cramps, you develop edema or swelling of the feet, etc., etc., because of the hormonal changes. And so these have to be taken into account. And then the second thing is the women are also equally affected by heart attack after the menopausal age group. And so the same rules what we discussed over the past 20-25 minutes apply to women. So one is a menopausal related change. Another change is actually during pregnancy. As I mentioned, some patients, some a woman can develop blood pressure changes, diabetes changes. Again, these need to be controlled in a pretty much aggressive or very systematic way. There are some rare heart diseases which can affect in pregnancy or in female, like coronary artery dissection, etc. But they happen in 1 in 1 million or etc. So probably generally it doesn't make a case. So by and large, the same rules will apply to female, and barring that menstruation age protection. Yes. So I think there aren't many questions left. So thank you all. So once again, I emphasize the importance of very simple maneuvers in your in your lifestyle, having give some emphasis on the exercise, the diet, and control of the already existing diseases you are already having. And of course, this is it should be implemented at the family and workplace level, had to bring in a good healthy heart lifestyle. With that, I'll conclude my words. I will probably meet sometime next month. And bye bye, and have a good day and good evening. Thank you. Bye bye.